Grenada has recorded its first case of the coronavirus COVID-19. The announcement was made on Sunday during a media conference by the Minister of Health, Nikolas Steele. The individual has been identified as a female who arrived in Grenada on March 16th from the United Kingdom and started displaying symptoms on March 17th.
So, I announce that today, Sunday, March 22nd, 2020, the first laboratory-confirmed case of COVID-19 in Grenada was diagnosed. Officials of the Ministry of Health are now aggressively conducting contact tracing. This is an imported case, and the patient is now in isolation to prevent the potential spread of the disease.
And St. Lucia will be under a curfew to coincide with the closure of all non-essential commercial services for 2 weeks. Prime Minister Alan Chastanet made the announcement on Friday at a press conference on the coronavirus COVID-19. As we hear from journalist Sherfield Gaylord in St. Lucia, the measures will begin tomorrow.
Only 2 confirmed cases of the coronavirus have been recorded in St. Lucia, and both cases were imported from the UK. Since then, the St. Lucian government expanded travel restrictions to include countries such as mainland France, Germany, Spain, and the United Kingdom. Screening protocols for persons arriving at both air and seaports were also strengthened. Individuals displaying any signs and symptoms were quarantined for a period of 14 days, pending their test results from CAFRA. Added to that, Prime Minister Alan Chastanet on Friday announced that government, effective March 23rd, would be implementing stringent social distancing protocols to protect the country from contracting more cases of the virus. Already, we have seen the closure of schools. All non-essential commercial services will be closed as well to reduce public interaction for a period of 2 weeks. Bars and restaurants have been ordered to close. Several resorts on the island, unfortunately, have been closed as well. Businesses are encouraged to, work from home where possible. And also, one of the announcements the Prime Minister made was that of an island-wide curfew from 11 p.m. to 5 a.m. daily, and that will run until April 5th. St. Lucians, are adhering to following the protocols. From since the Ministry of Health encouraged social distancing, the busy areas, especially in the city, are now, a ghost town. I think we have done a fantastic job in terms of containment and protocols. It is something new for us as citizens, but we are doing well. We are a resilient people, and we just want to see this nightmare over.
Well, the Caribbean region is going to need additional resources to tackle COVID-19. That's according to Pro Vice Chancellor and a Professor of Practice Global Affairs of the University of the West Indies, Ambassador Dr. Richard Bernal. He was speaking at the Vice Chancellor's Forum titled Caribbean Unity or Plurality. During the online discussion, CARICOM Assistant Secretary General Dr. Douglas Slater said they have tried to coordinate a collaborative approach to deal with COVID, but he said there are some member states taking more aggressive actions against the virus than some. He said during several CARICOM meetings, the issue of food security in the region was discussed.
And this is very important because, as we all are aware, we depend heavily on importation of most of our supplies, including and especially food, unfortunately, but that is the reality. We may also be aware that in several of the countries that export to us, they are implementing measures that may limit the availability of those supplies.
He said pretty soon there may be a shortage of supplies in the Caribbean.
For 2 reasons. One, there is hoarding in those countries. And 2, even to manufacture some of the supplies, including food, there are restrictions of numbers of persons going to those factories. So I think that is important for us to bear in mind.
Well, Dr. Slater said islands should now focus on limiting the importation of COVID cases and strengthen national health systems.